Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Last week, I talked about osteoporosis and got several questions mostly about what is the best form of calcium to take to prevent osteoporosis, and a few questions about how do you know when should you do a bone mineral density test. So I'm definitely going to talk about the best forms of calcium to take to prevent and reverse osteoporosis, as well as how do you know when you should take a bone mineral density test. The whole point is to be able to reduce your risk of osteoporosis and even reverse it back to osteopenia, also known as low bone density, and even reverse low bone density back to normal bone density without toxic drugs that really don't even work that well. But before I forget, I ran out of time last week to talk about some specific patients, so I pulled out some files. Here's a 65-year-old woman who was told that she had osteopenia, also known as low bone density, precursor for osteoporosis, and it was actually pretty mild. But still, her doctor told her that she should start taking Fosamax immediately. So just so you know, if you're otherwise healthy, compared to heavy people, thin white women tend to have the highest risk of osteoporosis and the debilitating fractures from low density that can happen if you have a sudden fall. So if you exercise regularly, and especially if you do resistance training to maintain muscle mass, in addition to burning more calories all the time and making it easier to keep your weight into the range that you want to keep it into, maintaining adequate muscle mass, sufficient muscle mass, significant muscle mass dramatically reduces your risk of osteoporosis. But even if you're carrying extra weight from fat, if you're a little overweight and carrying extra weight from adipose tissue, that still stresses your bones in a good way. Carrying excess fat around your abdomen causes a whole host of other problems. Cardiovascular problems can affect your hormones and even indirectly affect your bone density. But just the weight itself, any kind of weight, puts stress on your bones in a good way. That constant load stresses your bones, sends feedback to the mechanisms that they are used to responding to increase and maintain more bone mineral density to support and respond to shifting around that weight. So I'm going to say that again. If you're heavier, you have a lower risk of osteoporosis. Women have so many other things to worry about, and they're often constantly worrying about their weight, and it has a lot of effects on your health. But here's something to celebrate. If you're carrying extra weight, you're probably less likely to get osteoporosis. So this patient is a thin, white, 65-year-old woman who was told that she had osteopenia, and her doctor says she needs to immediately start taking Fosamax. But she was smart. She did her research. She read about it and heard about the fact that these drugs are often not good, and that was the main reason she came in to see me. So she wanted to know if there was something else that could work as well as the drugs without side effects. And she told me, she was very excited to tell me that she was already taking a multivitamin which had calcium and vitamin D in it. Well, what kind of calcium do you think she was taking? Calcium carbonate. It was a 1-a-day multivitamin with calcium carbonate. And how much vitamin D was she taking in her 1-a-day multivitamin? 400 units of vitamin D, the standard recommended daily allowance. For people younger than her, the daily value or recommended daily allowance for women that are older, her age, is actually 600 or 800 units, depending on which useless government reference you see on the label of your product. But so if you just tuned in, the standard adult dose for vitamin D for people who want to be healthy and especially have healthy bones and a healthy heart, reduce the risk of dementia, have a healthy brain, reduce the risk of virtually every type of cancer and a whole host of other conditions. If you're one of these people, you should take 5,000 units of vitamin D per day and get the blood test to make sure that you're achieving a serum level of vitamin D between 50 and 90. The standard medical range on the blood test that you'll get if you get your doctor to order it for you is 30 to 100. 30 to 100. But the healthy range, the most important range that you're looking for, you want to supplement No one gets enough vitamin D from the sun or from fish or from any food source to keep a strong immune system, reduce your risk of cancer and all the other things I just mentioned. You want your blood level of vitamin D to be between 50 and 90. And the only way anyone ever achieves that is to supplement about 5,000 units of vitamin D per day. Sometimes a little less. If you're way less than 120 pounds, 4,000 might be enough. If you have comorbidities like an autoimmune condition, previous history of cancer, other just anything that's stressing your health and causing your immune system to have to work harder. Lots of patients take 10,000 units of vitamin D for 2 or 3 years or longer and never end up with an elevated serum level. So there's all this hysteria in the mainstream press and the medical press that, oh my God, if you take too much vitamin D, it's going to cause kidney stones or some other unstated malady. The standard range is 30 to 100, and I have patients who come in and say, oh, my doctor saw that my blood level of vitamin D was 40, and so he said I should stop taking any vitamin D. The range right on the lab test is 30 to 100. LabCorp, Quest, any standard laboratory, the normal medical range is 30 to 100, and 30 is not enough. 40 is not enough. You want it to be between 50 and 90. And the standard of care is to wait 2 years. Whatever intervention you're going to do for a patient with osteoporosis is to wait 2 years, because it usually takes a couple of years to see a significant difference. And that's okay. As you get older, bone changes are very slow, so waiting 2 years if you're in your 70s or 80s isn't unreasonable, especially if you have significant osteoporosis. But this woman was 65 and looked like she could have been 49. She was taking great care of herself, exercising regularly, maintaining muscle mass, and exposing her bones to some impact every day by walking, jumping, doing gentle things that pounded, gave a little direct anti-gravity impact to her bones. And her insurance wouldn't pay for her doctor to order another DEXA scan for 2 years. So I ordered one for her after 1 year. And back then, I think it was about $150 if you're willing to pay out of pocket. It's even less now. I think the last time I checked, I'm pretty sure it was less than $100, maybe even as low as $85, something like that, at the radiology centers in Ventura County. And, the upshot is she had already reversed. She continued to exercise. I put her on 10,000 units of vitamin D for 3 months to get her serum level back up into the healthy range as quickly as possible. She continued to do her exercise, and I do it. Anybody with osteoporosis, I recommend a combination product, because nobody wants to take any more pills than they have to, and lots of top shelf manufacturers make combo products with vitamin D and vitamin K2 in one capsule. So one of the most common products I use is by Orthomolecular Products, called K-Force. And it's called K-Force because it has the standard 5,000 units of vitamin D that you need per day to maintain healthy levels in your body and your blood, plus 180 micrograms of vitamin K, which is 4 times what a lot of products have. Sort of the standard low dose of vitamin K2 is 45 micrograms. Some products have 90 micrograms. Anyone with osteoporosis, I recommend doubling that to 180 micrograms. And why do I do that? Because I've been treating patients with osteoporosis for 30 years, and one of the most common missing links. So patients come to me that have been to other functional medicine practitioners, or just, other doctors, or have done their own research and know that they should be taking adequate amounts of vitamin D and a good amount of vitamin K, and they're still not getting the result they need. And I've had so many cases like this with bone density issues, and also people with fractures that haven't healed. I've had a couple of people who injured their shoulder skiing, or broke a bone in their shoulder, or a few that broke a bone in their foot. And you're constantly moving your arm, you're constantly moving your feet. 6 months go by, the x-rays show the fracture hasn't healed at all, and just getting them on a good dose of vitamin D and a high dose of vitamin K2, and it will heal. So we had good reason to believe that this woman's bones would test out heading in the right direction if we did another DEXA scan. And so she chose to pay for that herself out of pocket. And it showed that she had indeed gone from osteopenia back to normal bone density. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking about osteoporosis, continuation of a discussion from last week. Had a bunch of questions last week about what is the best form of calcium to take to prevent osteoporosis, and how do you know when you should do a bone mineral density test, also known as a DEXA scan. So most doctors don't recommend, therefore most people don't get their insurance to pay for a bone mineral density test or a DEXA scan until they're in their late 60s, early 70s, unless you've had some kind of other reason to suggest that you're at an increased risk. Risk factors for osteoporosis include older age, being a female, having prior fractures or falls, low body weight, a history of hip fracture in a parent, taking steroids, glucocorticoids, cigarette smoking, excess alcohol consumption, and certain other diseases like inflammatory bowel disease, rheumatoid arthritis, chronic liver and kidney disease, and a few other much less common conditions. So here's another file. Here's a 72-year-old patient diagnosed with osteoporosis 5 years ago when she came into me, and she had done 2 DEXA scan bone mineral density tests. She'd been taking Boniva for those 5 years, and her latest bone density scan was slightly worse than the last one. Worse than the last one after treatment for 5 years. It's just not unusual because the goal of these drugs is just to slow the progression of osteoporosis. Most medical doctors are happy if you take these drugs for 2 years, come back and do another bone mineral density test, and your bone mineral density is exactly the same, or maybe even a little bit worse. Some of you might be surprised by that. Some of you may not. If you are surprised, I promise you I am not making this up. Where else do you get a test that shows you have a disease, then get a recommended standard treatment for that, well-researched in the medical press, funded by the pharmaceutical industry, that tells you this is the best thing for you, and you take that medication every day for 2 years, and then you come back and get the test to see if it's working or not, and the test is unchanged or slightly worse, and the doctor says, yeah, that's great. That is the standard practice of medicine for osteoporosis. That's not good. That's pathetic. So I explained all this to this lovely lady, and I did some blood tests and found out that her vitamin D level was 32, which, unsurprisingly, her regular doctor told her was totally fine. Incidentally, in addition to Boniva, she was taking a calcium supplement, Kirkland Signature Calcium, with 600 milligrams of calcium carbonate. Please review my previous episode to hear everything you should know about why you shouldn't take calcium carbonate. And I'll just, repeat a little bit of it now. No one should take Kirkland Signature Calcium. No one should take any Kirkland supplement. But anyway, the product she was taking was 600 milligrams of calcium carbonate, ground up rocks and seashells, and 400 units of vitamin D. The standard RDA, recommended daily value of vitamin D, 400 units a day. It's barely enough to maybe prevent rickets in a child. And, quite reasonably, because it says right on the label that this is 100% of the recommended daily value, she assumed that she's getting all the nutrients she needed to maintain healthy bones. Well, I'll say it again. No one should buy Kirkland Signature Calcium. No one should buy any Kirkland vitamins, and people buy them because they're cheap. And you don't get what you don't pay for, like healthy bones and other potential outcomes you're hoping to get from buying cheap, crappy vitamins that never do what you think they're going to do. The labels look pretty, and the government does regulate the labeling of all supplements. So whatever is on the label you can be assured that is in the tablet or capsule. What it never says, to give you any idea, is whether or not that the ingredients in that bottle will end up in your bloodstream, let alone in the tissues where you want those nutrients to end up to do the job that you're hoping that they will do. So I'm sorry, so many patients, I always tell everyone to bring in the products that they're taking. And so not all of them, some of them are upset. Some of them are actually not surprised at all. But if you're taking, cheap vitamins that you bought at Costco or a lot of other stores that are not health food stores, the likelihood is that, it's a waste of money. The most expensive misinvestment that you'll ever make in any product to improve your health is something that has no effect at all and just passes through your body and ends up in the sewer system. If you're just tuning in, I'm talking about a 72-year-old patient diagnosed with osteoporosis 5 years ago who has done 2 DEXA scan bone mineral density tests and has been taking the very common osteoporosis drug Boniva for 5 years. Her latest bone density scan is slightly worse than the last one. She's not excited about that, and that's why she came to me, and I recommend that she take 10,000 units of vitamin D for 3 months because it was so low. Well, if you tell your MD that you're going to take 10,000 units of vitamin D one day, they'll freak out because they just don't understand how that works. But lots of people take 10,000 units of vitamin D for a year, especially if they're in their 70s or 80s. And in so many patients that have told me they were doing this, even when I told them to cut it down from 10,000 back to 5,000 after usually 2, 3, 4 months, they say, oh, I forgot I've been taking 10,000 every day for a year. Their serum vitamin D levels are still fine after taking 10,000 units a day for up to a year. So for most people, 5,000 units a day is enough. But with any osteoporosis patient, it's also important, so important to take adequate amounts of vitamin K2. So I gave her a combo product with 5,000 units of vitamin D and a high dose of vitamin K2. And this is so important because it's hardly ever mentioned in the literature, and vitamin K2 is critically important for maintaining bone density and reversing low bone density. It comes in several forms. MK7 and MK4 are the most common in supplements, but the most important thing is to know that vitamin K2 is not the same as vitamin K1. Vitamin K1 is the one that you hear about that's in food, and it's also important for bone health and for a whole host of other reasons. Vitamin K1 is ubiquitous in dark green leafy vegetables. If you eat salads regularly, which include anything dark green like broccoli, kale, spinach, mixed greens, if you do any kind of super greens shake as part of your diet, then you're usually getting plenty of vitamin K1. And vitamin K1 is very important. But the missing link with most people who have osteoporosis, one of the most important additions that I've found, if someone has tried everything, been doing a pretty good job of, getting some nutrients, when I add extra vitamin K2, that makes all the difference. I've had so many patients that did a trial, didn't get the results they were looking for, and if they were already doing the vitamin D and a good bioavailable calcium, that's actually pretty rare. But the few times that I have had that, somebody's already taking good bioavailable calcium and 5,000 units of vitamin D, or at least maintaining the serum level that they want. They're still not getting the reversal or the stoppage of the decay in osteoporosis. We add a higher dose of vitamin K2. So the normal dose in most supplements of vitamin K2 comes in a couple of forms. MK7 and MK4 are the most common. The ones with the MK7 form usually dose it at 45 micrograms, some 90 micrograms. And the product I recommend, K-Force by Orthomolecular Products, for patients like this, is 180 micrograms of MK7 form of K2. So the upshot is this 72-year-old patient diagnosed with osteoporosis for 5 years, who had done 2 DEXA scan bone mineral density tests and had been taking Boniva for 5 years, and the last one had been slightly worse than the previous one. At her age, it basically made sense to wait a couple of years to see a significant shift. And 2 years later, her bone density score actually got better after getting slightly worse when she'd been taking the standard medical advice for 5 years before that. She didn't go from osteoporosis fully down to osteopenia, possibly because she didn't exercise enough, and mostly because she started so late. But it was still a significant improvement that she was very happy about. She also fell a couple of times during this period, and she didn't break anything. In my mind, that's an even better test. The whole goal is to prevent ending up in the hospital with a hip fracture and then getting some horrible infection that you can only get in a hospital while you're waiting for your fracture to heal. And people die from that. It's really sad. Last week, I referenced an article published in the Journal of the American College of Cardiology in 2021, and some of the mostly stupid advice included in that unfortunately is the advice that most doctors are getting and recommending to their patients. But buried near the end of that paper is the following, which is a little encouraging. Quote, "Other research should evaluate the effects of different dosing strategies of calcium supplements and types of calcium supplement formulations." Wow, what a great thought. Additional research is also needed to further understand the effect of combined calcium plus vitamin D supplementation on cardiovascular outcomes. But all of this is immediately nullified by the very next sentence that begins the conclusion section. Quote, "Although vitamin D does not appear to be harmful for cardiovascular health, the lack of a demonstrable benefit of supplementation in randomized controlled trials should discourage its use for this purpose." How ridiculous is that? These are the mainstream recommendations for cardiovascular health, for vitamin D supplementation, calcium supplementation, that all doctors get, that most people are taking the advice of. It's unconscionable, mostly because robust research exists, which is available on PubMed. Just Google PubMed, benefits of vitamin D, cardiovascular health. You'll see robust, abundant studies showing the benefits of adequate vitamin D supplementation for reducing your risk of cardiovascular disease, bone health, cancers, a whole host of other conditions. So lastly, this article that is the standard recommendations for all doctors to advise their patients on how to take better care of their bone health. It says, for many patients with nutrient deficiencies that cannot be fulfilled with dietary changes, supplementation plays an important role in correcting those gaps. However, many persons who do not have clear nutrient deficiencies also may take supplements in the misguided belief that they are optimizing their health through, quote, natural means. One should capitalize on such patient motivation for non-pharmacological health promotion by encouraging, their quotes, natural lifestyles, being physically active, eating a heart-healthy diet, abstaining from tobacco products and excessive alcohol, and maintaining optimal weight. Okay, raise your hands if any of that is news to you. Raise your hand if you didn't know that being physically active, eating a heart-healthy diet, abstaining from tobacco and excess alcohol, and maintaining an optimal weight are good for your health. Far more importantly, what if you've already tried that? What if you're already doing the best you can, knowing what you know, and you're looking for a little extra support? I'd love an opportunity to help you or someone you love identify the things that are missing your diet and healthy supplement regimen, things that could change your life with proper testing to identify where you just need a little bit of extra support. And in the meantime, go for a walk. Reach out to someone that you haven't spoken to in years. Find something you can do to make next week healthier than you were last week. Have a great weekend.